So hello everyone and welcome to the fourth webinar of our series of webinars that present the results of the living co-creation workshops that engage industry and end users. So I would first like to introduce you to our project Living Innovation to give some context to the webinar. Living is an initiative that was started by 14 partners from all over Europe, and that includes major industry leaders, civil society, and research organizations. So we are collaborating to co-create more responsible approaches to innovation in the areas of smart homes and smart health. Within the Living project, 20 co-creation workshops will take place and are already taking place in 5 European countries throughout 2019 and 2020. So those workshops, which have already started, aim to engage industry representatives, lead users, and citizens in co-creation processes. So their goal is to develop new solutions or to improve existing solutions that at the same time would satisfy user needs, tackle societal challenges, and create new business opportunities. If you'd like to know more about the project, we warmly invite you to register on our platform www.living-innovation.net. There you'll find more information about it and you can take part if you wish. The webinar today presents the results of one of the co-creation workshops that was led by SmartHomes in early September. SmartHomes is the Dutch National Expert Center for Smart Houses and Smart Living, and it is based in Eindhoven. The workshop explored the possibilities of social robots in future care homes with an eye on responsible innovation. So this webinar, Will Robots Care for Us?, presents the results of that workshop. I would now like to introduce our featured presenters today, Advan Berlo and Marjolein Winters. Advan Berlo is both mechanical engineer and psychogerontologist, and he has a PhD in biomedical technology. In 1998, he founded SmartHomes, where he is currently research and development manager. Ad has 20 years of experience in smart home technology, smart living, care technology, e-health, and telemedicine. He was also chair of the Forum Program Committee of the Active Assisted Living Forum 2012 in Eindhoven. Marjolein Winters has a background in health sciences and has specialized in the field of healthcare policy, innovation, and management. She studied at Maastricht University and at the London School of Hygiene and Tropical Medicine. Marjolein is now project manager at SmartHomes after working as a policy manager in a hospital. So before we start, I would just like to quickly make you aware that the webinar is being recorded and it will be sent to you in the coming weeks. Also, if problems arise with audio or video during the webinar, please make sure to let us know via the chat box and we will try to solve it as soon as possible. At the end of the webinar, we will also have some time for Q&A for attendees, so please also send us all your questions via the chat box or by using our email address info@living-innovation.net. So with that, I will pass on to Ad and Marjolein. Welcome to you both.
Well, thanks for your introduction, Teresa. So today's agenda will be starting with an introduction about the current status of robotics. Then we will discuss the results of the role-play and group work in the workshop. We will shortly discuss responsible research and innovation, the results of this discussion, and we will wrap up with a conclusion. So what we did this workshop at TanteLouise. And TanteLouise is a nursing home in West Brabant, the Netherlands. Our participants were nurses or caregivers to patients with dementia. And together we aim to sketch the ideal social robotic in 2030. This was our agenda, so it was a morning session. We started by introducing all the patients, all the nurses to each other. Then we had a first quiz to test the knowledge about robotics. Then an introduction on the state of art. We had a short coffee break. And then we had 2 long group rounds, and we tried to aim to work together to sketch our picture. So now we will start with a short introduction of the current state of robotics. There are a few definitions given. The first one that we use is a social robot is a robot which can carry out certain non-physical tasks by using technologies such as speech, face, and emotional recognition. And another one states robots in which social interaction is the main characteristic. So in short, it is usually the ability to communicate with people. There are different types of social robots. The first one is a humanoid robot, and that's a robot with its body shape built to resemble the human body. And the design may be for functional purposes, such as interacting with human tools and environments, but can also be for experimental purposes. In general, humanoid robots have a torso, a head, 2 arms, and 2 legs, though some forms of humanoid robots may only be part of a body, for example, only from the waist up. Some humanoid robots also have heads designed to replicate human facial features such as eyes and mouths, and also androids, which of course we know from our own mobile phones, are humanoid robots built to resemble humans. On the right, we see an animaloid robot, and these are usually used to comfort and entertain lonely older persons. That is their main purpose. And they usually function as pets. So now I'll give you a few examples of robots that are currently used in healthcare. Well, the first one is also quite a common one. It's called the Paro. And the Paro is an advanced interactive robot. And it has been found to reduce patient stress, but also from the caregivers. It stimulates interaction between patients and caregivers. And it also has been shown to have a psychological effect on patients. For example, improving their relaxation and motivation with other caregivers. So it's some kind of robot seal, and it also reacts on voice and touch. And currently in the Netherlands, we have 230 Paros. The next one, now we see a humanoid robot, and it's used as entertainment. So it can provide you stories, music, dance, and exercise. It's also used for patients with dementia. Now in the Netherlands, we have 100 Zoras, and outside of the Netherlands, 400. And it's been developed by SoftBank Robotics, and it's a really, really big company that develops robots. The next one is also a Dutch one. It's a Tessabot, and it's a little flower pot, and it's quite popular because it's not as expensive as some robots are. It functions on social intelligence, and it's also for persons with early dementia, but it can also be used for people with autistic children. The next one, this is a really famous one, and this is the Pepper. And the Pepper was the world's first social humanoid robot able to recognize faces and basic human emotions. Pepper was optimized for human interaction and is able to engage with people through conversation and his touchscreen. This one is also a little pet. It's a cat and it's called a companion robot cat. And it's also for people with dementia, and it reacts on movement. So for example, if you pet the cat, it will purr a bit. So it will provide you some kind of social interaction. This is the Alik. This is, it tries to make easier connection with friends, families, and just the digital world. It helps you to stay engaged in the world around you and to help family members stay close to you. So it's also working for people who are a bit older, and it can provide you with video calls, messages, photos, everything you want. Here's the Rose. It's also a Dutch one. It's not yet on the market. It helps you with all daily living tasks, and it's also for older and disabled persons. It is quite a different one because it's not only for social, but it's also really helping you, for example, handing over food or whatever might be needed. And this is the Othello. This is a project, and it has its scope on personal robotics technology, actually supporting self-care activities or care robots. Explicitly, it's been chosen for the development of care robotics that support the challenged elderly user or herself and will enable the performance of essential daily activities with the least possible dependency on external assistance. This one is also not yet on the market, but is really close. So these are kind of the future robots. We've also been doing a lot of projects in smart homes, and then I would be happy to give the floor to Ad to explain a bit about this.
Yeah, good afternoon, everybody. So we have seen in the past two slides two examples of. Now maybe you can leave it as this, Marjolein, because yeah, maybe then I ask you to switch to the next button because we are not at the same location. All right, so in the previous two slides, you saw the service robots, what we call service robots, and not so much social robotics. Service definitely have an arm and they can grab something, and they, as you saw also from the previous two slides, they are not really on the market simply because they are quite expensive to make for smaller companies. We will see some other examples in a few moments. But here you see two examples of robotics, social robotics that we have been working ourselves. We have been working ourselves on in European funded programs. The left one started in 2008 and ended in 2012, and the upper right one was something between 2010 and 2014. So quite some time ago. And these two robotics, the upper right, it was a French company which went bankrupt, and now they are restarting again. But that's not really on the market. It's still in the funded projects. And the left one, the yellow one, is a German robot which had some functionalities, as you see that person also using. Games, you could the robot could find the person. That was already quite something. Could talk to the robot, but the speech synthesis at that time, 2010, 2012, was very limited, and he didn't understand the older person very well. So I would really consider these kind of projects as a very early stage, very early beginning, but we learned a lot. And also the persons you see here, they had certain needs for remembering, reminding functions like taking medicines, not forget some appointments, and so on. So yeah, next slide. Yeah, maybe we can go now very short to the first one, maybe not the second one, but the first one is a good example of service robotics, which are made by the world's most, there is still some advertisements, I think. Oh, this is not the right one. Why is this? Yeah, I see it. If you go to the site again, you see on the right, I think, yeah, the next, if you go with the mouse to the right, you see 8 new robot inventions that will shock you. Probably it's that one. I'm not 100% sure. No, it's the next generation robots, the next one. Yeah, that video. And maybe you browse a little bit further. A little bit, yeah, few minutes, yeah, somewhere there, a little bit back. Anyway, you see here, we don't go in these 12 minutes, but this is really what is available right now. So it's Boston Dynamics is famous for it, but these robots are coming on the market, and it was announced only last week, not this one, but the one you will see in a minute. And yeah, this is coming now on the market, and all the others are still prototypes. This one is yeah, well, now it's gone, but it's a sort of dog, and you can have that dog in your house or whatever, do with it. So that's now available. This one not, but it gives you a very good example of, yeah, where we are with really the state of the art. And believe me, it's very difficult to make such a robot keeping its equilibrium, not falling down. And if it falls down, then people can easily, it can stand up itself. It has here, this arm is also, look at that in a minute. You see that this arm is very sophisticated. You see, it can keep quiet, it can do anything, it can also help you in the kitchen. It's still, yeah, experimental, but it can, it's, by the way, not a video that we wanted to show, but anyway, this is one of the best examples of IUC, an example of a service. So we showed this video, and also Sophia, which was the other one we wanted to show, but maybe for time reasons we don't do it right now. Sophia is a really humanoid person, and maybe some of you, maybe Marjolein, you stop now this video, because it's, yeah, we go back to the, yeah, and yeah, we don't need to go to the other one, but Sophia is a real humanoid. It has the same size of a real human being, and she has a really friendly face. She can talk, and she has been in big talk shows in the US. She has been with Angela Merkel, with Macron, as the example of the humanoid which is present right now. She has her back of the head is transparent, so you can see the electronics through it, so that you don't think it's a real woman. But yeah, it's really state of the art of hands-on robotics, where speech is very well advanced. But of course, you cannot have a good talk with her. Everything is programmed, and yeah, we are advancing quite a lot, but we are not there where we want to be, of course. So these two videos were shown, and there was also not this picture, but I didn't find another picture, but the real robot that we are going to work with is in the middle. It's a small one. We kneeled, these two persons. Left is myself. Maybe you recognize that from the previous slide. But we were sitting there with that small robot. We chose for that for a couple of reasons. To start with, it's of course without software. We all need to program it. It's a sort of intermediate between Pepper and let's say Sophia. No, even not Pepper. Sophia is a real human being size. Pepper is a little bit smaller, and this is even smaller. But we chose it for a couple of reasons. And we means a company and TanteLouise to start working on social interactions with a robot and demented persons. We chose for it because it's easy programmable, it has quite some advanced sensors, and it is relatively cheap. For your information, such a robot is available now for sale in China for 6,000 euros. So that gives an idea of where we are. But it's totally empty, it has no software, nothing. So you can't do anything too much. You can do too much with it. Next slide. So we did in this workshop some role playing, and the next slide gives an idea of what we asked to do. So we had 12 persons, and all these 12 persons were more or less directly involved in care for people with dementia. So we call the robot Sarah, and Sarah will be developed according to what the care people think is good in the care for dementia. So we did not have the demented persons themselves in this workshop. We did not have the family carers, but only the professional carers and some staff members. So we said, consider yourself as well, a senior with dementia. One of the 4 people should be a senior person with dementia, another one the carer, so the professional care, another person the family member, family care, so the partner or daughter or son, and the 4th person should play Sarah. And then we said, now try to think about, it's lunchtime is approaching. How would these 4 beings, because the robot is not a human being, but how would they interact ideally in 10 years from now, and how can we think that it would be useful? So the next group, the other group, the second group was thinking about preparing for sleeping, because we were told already before that when in a nursing home a group of 8 fully demented persons need to prepare for sleeping, no, then it's quite hectic with 2 full-time care professionals helping them. So there also the robot could help. And then the other thing is, giving company or entertainment or distraction or whatever you call it during the day, also during rush hours, because sometimes what you see is that 2 full-time professionals cannot deal with all problems at the same time when 8 demented persons are needing some care or some attention. So therefore, it was thought, and it is still or thinking, that we can design a SARA robot with some useful functions that can assist the care people. So assist the 2 carers that are there. Sometimes they are accompanied by informal carers, but that at least it will help and improve the care for the 8 persons. By the way, I didn't say that, but this is a way of living that is quite popular in the Netherlands, where at minimum 6 and most of the nursing homes 8 persons with severe dementia are living in a group together. They all have their own bedroom, which is only accessible by themselves, not by another person, via a tag in this case with TanteLouise. So you cannot accidentally open the door of your neighbor because the tag would not open the door. So these kind of smart solutions are already there, but this is more or less the situation. So the 8 persons are sitting together during the day in the living room, in the common shared living room, and they have also sort of kitchen where they do not really cook because that's all provided, but they can make some sandwiches and things like that. Okay, so the aim was to understand how different users react and how to find out what Sarah is missing or needs to do. Next slide. So what did we find? The role playing was successful more or less. Not that the 3 groups really played such a scenario as I indicated, but by talking about it and by doing it half or partly, they've found that there were a lot of discussions going on. So it raised a lot of items that had to be discussed and that were important to mention. Now, in all 3 groups, and I start here with the first group, was that the most important functionality was signaling of abnormal, dangerous, or strange behavior or patterns of the people with dementia. So that is what all consider as most important. The second, thing that came in the first group, but also mentioned many times, is that personalized care should become possible when introducing such a robot, because such a robot could capture large-scale data during the day, also maybe fed by other sensors in the surrounding, and that would enable really personalized care, which is now, of course, also possible, but not as good as we think with the robots, because we don't often know, the care workers don't know exactly what has happened in the morning or what has happened in the past, maybe in the past few months. And also you have, of course, shift of care workers. So then the other third important thing is entertainment, stimulation of physical and mental activities. And it was also said, particularly positive stimulation is very important for people with dementia. Don't ask, how are you today? That is not something that people consider as positive, but more like maybe it's good to start talking or chatting or do some game with another person, and that's more positive stimulation than asking that simple question. So tips and support for nursing staff in certain care situations was mentioned here as most important. So there were many other things, but I summarize here in that group 1, the 4 most important findings. Next slide is the second group. They said, and yeah, I also said already they had similar things as in the first group, but what also came here was a robot should calm down a person with dementia and give him or her a sort of affection and a feeling of safety and reliance. So yeah, easily written down or said and more difficult to do. But yeah, I've noticed already in the 10 years that we were working in the other robots that affection, not really by heavily demented persons, but by people with MCI, mild cognitive impairment, or even healthy older persons, is quite easy to get. So it seems that after, it appears, I should say, that after working or playing with such a robot, even in a situation where it was very bad functioning, but let's say not as good as they are these days, that some affection can really come up. But the robot should, of course, function 100% without any failure, else you can never rely. The robot could prevent forms of aggression or teach the carers how to cope with that. That's another very important thing. Aggression is often coming up. Attention should be given to the new Dutch legislation around care and coercion. For example, will the algorithms in the robot follow this legislation? That was the question that also came up. So yeah, I don't have time now to go into this law, but that's also quite important. Yeah, and then the final slide on the first round results. That was more or less also mentioned by the second and the third group. Robots should assist the professional caregiver in how to react in certain sudden interventions that are needed. Robots should support the informal caregiver and volunteers as well. The robot should give live videos. This is maybe a little bit surprising, because if you see that that a person with dementia is often confused, and then he looks at the video of someone remotely. But okay, apparently there is some need for that. Robots should make videos frequently. This is so if a robot is assisting or is all the time with a person with dementia, the robot could easily make videos. And that makes it easy for the informal care or even the formal care to find out what happened earlier during the day. So that's a function that is really also wanted or proposed several times. Yeah, and then also very important, administration of medicine, help, not being fully responsible. That's still not very, let's say reliable, but help in administration is also mentioned. Next. Yeah, and then a change of personnel, which happens, of course. The robot should give updated information of what happened earlier. Robots should keep updated agendas. Yeah. Robot could play certain music, but should first ask the person with dementia if he or she agrees. So that's another, not unimportant thing, what you would maybe not expect, but don't start playing music immediately. First ask the person, would you like to listen to sort of music? If a person with dementia behaves aggressively, the robot should have to calm down. That was already mentioned. So again, this is some repetition from the other work group. Yeah, then RI. I don't know if we go too much in detail here, but you all know more or less, I think, what RRI is. It implies that societal sectors work together during the whole research and innovation process in order to better align both the process and outcomes with the values, needs, and expectations in society. Well, that's an official definition. And there were, during the workshop, we also presented a video on it and some more slides. Now, after this, when the 12 people had listened to that, there was a second round to discuss. And here you see their concerns regarding RRI. And I think there are 3 slides left to talk about that. By 2030, robots will definitely recognize each individual person with dementia, for sure, by external attributes, but also via profiling of behavior. That is by itself already happening these days. Google and Amazon and so on, all these companies are profiling already behavior of persons. But yeah, a robot will do that, of course, of that individual person. And then, yeah, you need a code of ethics already from now, to start with it right now, when we develop the algorithms. And we know that AI ethics are coming up, and even the European Commission, also national governments are working on that. A robot should monitor and register a changing disease pattern in detail, and based on that suggest new care regimens. Yeah, this is also something to be expected in the next years, maybe in 10 years only. But yeah, changing disease pattern is often the case. As you all know, dementia is, or Alzheimer, I should say, the disease of Alzheimer is progressing, unfortunately. And yeah, that means also many other characteristics that need to be monitored, and that will mean definitely new care regimes. Next slide. So yeah, the robot is expected to be a big support and advisor also for future care. The question was raised, would a robot consult other robots in certain difficult situations, or is the robot by itself so smart that that decision by that particular robot is always right? That was a real question coming up. Would a robot make wrong decisions? Yeah, it's another good question. And would a robot learn from it? Maybe the latter one, yes. But if a robot takes wrong decision, who decides about what is wrong? A human being? Because the robot has so much data and might have the right decision, but is maybe interpreted as wrong. Artificial intelligence is probably culture dependent. So if, for instance, software engineers in a particular culture write the algorithms, maybe it's different in other cultures. So also be aware of that. Next slide. Yeah, could a robot play a role in making ethical decisions if the current multidisciplinary team needs to take difficult decisions in certain care? So what is meant is that sometimes you really need all kinds of a team, real people, the care worker, the psychologist, the dietitian, the geriatrician, who else, the family, and to make a certain decision. And then the question is here, would a robot add here ethical aspects, or can a robot not have ethical aspects or suggest ethical decisions? That's the question. To what extent will a robot become prescriptive or forced to do certain things? So yeah, prescriptive, forcing things, you know what I mean. And is there still a freedom of choice for a person with dementia, particularly if you realize that the person with dementia is already very uncertain and very vulnerable. Next slide. And by 2030, it's most likely that predictive analytics, people are working on it already, but they will enable to predict certain behavior and needs. So also we expect at that time that the robot or artificial intelligence will expect really accurate the remaining life expectancy. And that could help deciding about the right remaining treatment and care pathways. Next. So there were 2 warnings. Don't create too high expectations on technical possibilities towards the people with dementia and of course the family. And the final warning was a human being and not a robot should, even in 2030, take the final decisions on whatever is necessary around life, ending the life, or well, even take important interventions at that time. I think this is it. Next. Now, the final conclusion, but that's more or less a summary as well. Yeah, I summarized again, so it's not really different from what I showed earlier. And the next slide is also a summary, yeah, about what I just said to you. I think that's it for the moment. Yeah.
All right. Thank you very much to you both, Ad and Marjolein, for your presentations. We are now going to enter the short discussion. We have 10 minutes for questions from the audience. So please, we've already received some questions, but feel free to ask some more on the chat or via the email address info@living-innovation.net. So one of the first questions that was asked at or Marjolein, it's what were the main challenges and needs that the caregivers expressed regarding technology generally in their everyday work, and maybe more specifically regarding social robots?
Yeah, I think I've mentioned them although maybe more general than in detail. Yeah, it was seen on the first slides. The care workers needed some, yeah, would like to rely on the robots when certain sudden interventions have to be made. So they would like to need some support, yeah, entertainment, distraction of the persons with dementia during rush hours, during, for instance, dinner time or lunchtime or going to sleep. Support here is very much welcomed. Yeah, and I consider the other important thing as recording what the person is doing during the day. So the robot guides. So in the ideal situation, would have 8 robots maybe for 8 individual clients, which is not going to happen very, very soon, of course, because of the cost and so on, and other practicalities. But yeah, that at least we capture the daily behavior, the daily activities of a person with dementia. That is also wanted. So maybe these 3 are the most important ones.
Thank you. Another question is that from the experiences of caregivers, are elderly people willing to interact with robots, or do they feel somehow dehumanized by it? Do you have any insights from that from your workshop?
Yeah, well, we didn't ask these people, not yet. That will happen in the next few months when we really start working with that Sarah robot. But I know from my own experience in the past with less heavily demented persons, so people with MCI, that they definitely want to work with that, and they are curious, they are excited. So I've seen also people crying when it was taken away. I've seen people really become happy. You know, it's a sort of unexpected happening, distraction or entertainment. That's what we saw. So there is no resistance. There was not so much resistance. No.
Mm-hmm. And you mentioned that you were going to work with Sarah in the next month. So what are you? So can you just tell us, yeah, from the results of the workshop, how is it going to impact your work in the next few months, a bit more in detail?
Well, I can only say in the next years, not in the next months. Certainly not. It's so difficult. As I said, we have been working with all the technologies for 10 years, and progress was very small. So we cannot expect, although we have much more advanced AI and whatever, and sensors, much better sensors and speech recognition, but still we cannot expect that the most difficult target group that we have, people with heavy dementia, that we can find solutions in a couple of months. So we will gradually write some software, not us, but the people that work about it, and then try it out. And I'm also sure that when you have even 8 persons in one group, that they all require 8 different solutions. And I hope that maybe some people can use the same robot, but I'm not so sure. I think there was a written question. Let me see where I can find it.
Yeah, I can say it for you if you want. How about fall predictions? So do you think that robots could be used to identify when a person falls?
Yeah, but for that you don't need a robot for that. As probably everybody knows, that falls in aged in elderly care is one of the biggest problems. You can monitor falls by many ways. You can do that with sensors on the wrist. With of course when it happens, when it has happened. And that's not easy for a demented person to push a button because he simply is not aware of that. Yeah, you can have cameras in the house. You don't need it on a robot, but yes, indeed, we did it also in the past that we looked at and we simulated that a person fell down on the floor and that a robot noted that. But yeah, you don't need a robot for that per se. It's easy and or not well not easy, but you could do it. But as I said, there are many other options like a smart floor, which I didn't mention. There are many other sensors fixed in the house that you could easily also have to detect falls.
Regarding, it's a bit related to what you just said, but another question is asking, do you actually need a physical robot device? Because most or all of the proposals from the workshop don't seem to need a robot.
Yeah, that's a good question. But what we have learned from our experiments in the past is that people really like some embodiment. So, and we think it's even more with people with dementia, with heavy dementia, if a wall or if a screen is talking back to you, they don't know what to do with it. They are confused. But if there is something like a humanoid or even an animaloid is coming to you, it raises attention. You listen to it, you look at it, you touch it, and that's why I think, particularly for this group, a real embodied computer, whatever you call such a robot, is more important. So that's the reason. Yes, I believe very strongly in it. And as I said, people started to get even affection for it, and you cannot develop affection, I think, for a screen or something in the wall.
And one last question. This is also quite related to the RI discussion that you summarized, but how transparent are the decision-making processes of the robots? So maybe regarding AI biases, how can elderly people with low tech literacy access the decision? So do you see any dangers there?
Yeah. It's building trust, of course, with the robot. That if a robot takes maybe the wrong decision or a decision that the person doesn't like, he will not trust the robot anymore. Is it transparent? Yes, I think it's very transparent. All what the robot does or says is programmed, pre-programmed. Unless we are maybe 20 years from now that we are not controlling that anymore as human beings. Yeah, but that's a bridge further. I would say, yeah, for the time being, we can rely and trust the things that the robot suggests. Yeah.
Great. Thank you very much to the participants and to you, Ad and Marjolein, for sharing your knowledge with us today. Our team will be reaching out in the next weeks with follow-up information about the webinar. And you can also always visit us on our website, www.living-innovation.net. So thank you all very much for joining us today and have a great rest of your day.